Good afternoon, and thank you again for joining us for today's webinar, Integrating Health and Wellness in Supportive Service Programs. Today's presenter is Erin Hart. Erin is the Director of Health Benefit Services with American Healthcare Group. She created one of their key programs, Farm to Table, in 2006. Farm to Table Western PA unites farms and food producers with local consumers. The program consists of an annual conference, regional tasting events, a business-to-business network, lunch and learn series, and ongoing educational programs to teach consumers how to eat healthy, local, real food. Erin developed American Healthcare Group's Supportive Services program that provides social services and healthcare services to residents in affordable housing. In 2011, she started the Where to Turn Resource Fair, a biannual social service conference for industry professionals in Western PA. She is a frequent speaker in the Pennsylvania healthcare and housing industries. Erin is a licensed insurance broker specializing in healthcare options for seniors. She earned a Bachelor's of Arts in English from Allegheny College in Meadville, PA, and she has been working with American Healthcare Group since 1994. She resides in Pittsburgh with her husband and 3 children. Thank you, Erin, for joining us today, and I'm going to hand the presentation over to you.
Thanks, Colleen. Hi, everyone. Thanks for joining our presentation today, Integrating Health and Wellness Programs and Supportive Services Programs. Just a little background about American Healthcare Group, and I'll go through this as we go through the slides. We first started working in affordable housing about 15 years ago, delivering health fairs and immunization clinics to any building that was in the community. So we have a pretty robust wellness program that we deliver to corporate sites and school districts. So we had met various housing authorities who, wanted us to come in to deliver these on-site programs. We first contracted with a housing authority back in 2009 for them to outsource their supportive services program to us. And our background in wellness and healthcare, made us just come out the housing industry from a completely different angle. And, our background was only in healthcare, and I didn't know anything about affordable housing when we first started working in it. So to us, having a nurse on site with seniors made so much sense. So, when we're working in a school district, when there's a lot of kids, there's always a school nurse. And in a lot of corporate sites, there's occupational medicine, and a lot of companies have company doctors. If it's a manufacturing site, a lot of times they'll have a nurse on site to do various wellness or safety trainings, injuries. So that's our background, and that's why we speak very differently than housing people. Now that I've been involved for so long, I know the lingo and I understand what it is, and it's interesting now because these two industries are converging. In southwestern Pennsylvania, Community Health Choices started, which is a Medicaid managed care program. So every housing conference I go to now, people are talking about this, integrating healthcare and housing, and how it makes sense to co-locate services. So what today's presentation is basically going to be is to give you a rundown. It's sort of like a behind the scenes, what we've done over the past 9 years to deliver this programming, where we've had a nurse. We split the services in half, or maybe 75% and 25%, depending on the number of residents. So if the building is required to have 20 hours a week of supportive services, a service coordinator will go in for 15, and then a nurse will go in for 5. And why it makes sense, for housing to look at healthcare services, are basically listed on this first slide here. Supportive housing improves access to community-based healthcare services. And, why that happens, a big reason is the community realm. I'm sure if you've worked with scattered sites and you're trying to deliver any kind of supportive services to people living across the community in households that are single-family dwellings. It's so hard to get people together because of, people live their lives and they don't necessarily want to come to a central location. But if it's a community room on the property or in the building, then it's a natural place to have healthcare providers come on site to deliver these kinds of programs. So essentially, in terms of, the services that are offered, the community room is the central location for any group meetings. But then we also use the supportive services office because it's private and there's a locked filing cabinet and there's a computer, so that if a nurse needs to get online or, make notes in a chart or just counsel people directly, they have that private area that's protected, and so their private health information won't get out, if you were trying to deliver services in a public space. So our program, the number one priority are resident assessments, and our service coordinators and nurse coordinators provide 2 separate assessments for all the residents in the building, and we do these annually. So it's essentially a questionnaire to make sure that they have access to food, if they need, from the nurse's side, if they need to increase physical activity. So a lot of people have aches and pains and, just some movement or some physical therapy in a group setting can help them significantly. There are healthcare providers that we've worked with that do group office visits. So they'll sit in the community room and a physician assistant will come and talk to everyone, either a mental health provider or even a primary care provider will come and do these group visits. And there's codes that they can use to bill for those. So the idea is let's deliver programs on site without having a budget. And that's as you know, as soon as you try to start doing something new, there's never a budget to do it. And then we do, as I said, we do these annually so that we can notice changes. So on a micro level, so each resident, we look at, what do you need in order to age in place or to live here successfully. From a macro level, we do surveys with the residents, but we also take these individual assessments and put them into results so that we can see overall what types of services are the residents not getting. So you think, people go into, especially in new buildings, and they want to implement, programs A, B, and C when the residents aren't interested in A, they don't need B, and they really only want C. So putting your eggs in the baskets where you can actually affect change is important. And, that's coming at it from a wellness perspective. When you do wellness programming, it's, sort of the same thing. When you're in a corporate environment, if you're not returning results and results on your investments, they just won't continue it. So you have to make sure what you're doing is effective and making changes for individuals and for the group as a whole. The communication tools that we use for residents, I'm going to share my screen so that you can see our brochures. When we go into a senior site, this is the brochure. It's just a simple trifold brochure that we developed, and this is what we give to the residents so that they know what the service coordinator and the service coordination office can help them with. Over on the right side where it says healthcare services, the nurses do a lot of this work, and they're available on a weekly basis to provide blood pressure checks. They help people who have diabetes, if they have to draw insulin up into a syringe, they can help them with that. They give injections like B12 shots. There are a lot of healthcare services that need to take place on a regular basis for certain residents, and if they're not taking place, then people can get really sick. In situations where people are hospitalized, as they're being discharged, we work with their providers to make sure they have the right home health companies. A lot of the insurance carriers now will provide food. So if someone's discharged from the hospital, they might send over like 14 frozen dinners. And so helping to arrange for all of that. And, again, we have that assessment that we use, so we reassess people as their situations change. So maybe now they have a walker or they have a wheelchair. And what's great about having a nurse there is that a nurse understands the language around durable medical equipment, and they just, they have an understanding of the healthcare industry and how providers work. And the service coordinator continues, to help them with their paperwork for making sure they have the right insurance. A lot of people, they might have their insurance change, and all of a sudden their oxygen company might be out of network. So we really help them get all of the financial resources lined up to pay for the healthcare services that they need. So sometimes it's a simple matter of, they shouldn't have changed their insurance, and they should go back to the carrier that they had before. Or maybe they can switch providers, and it's just a matter of making those phone calls. But as you know, people are very intimidated when they call to try to navigate their bills and so forth. So this other brochure is what we used for family sites. So you'll see a little more information about education assistance and family assistance. So if kids need a place to go after school, childcare, summer programs, summer lunch programs. On the family sites, we typically don't have a nurse who is located on site. It's usually only in our senior locations. We're providing supportive services in about 50 properties across Pennsylvania, and 30 of them are senior sites. So we have nurses that go into those senior sites on a weekly basis. So if you want to see where these brochures are, if you just go to our website, American Healthcare Group, corporate site, american-healthcare.net, and you would click on supportive services, and the links to those two are right here. The supportive services for seniors and then for families. As I mentioned, we provide supportive services and health and wellness programming and affordable housing. We also, in addition to the 50 where we're located, we do immunization clinics and health fairs in probably 200 more sites throughout the region. And the funding comes from either sponsorships or the supportive services escrow account. So the sponsorships can be simply having health fairs annually, and if a home health company comes in, ask them for a $50 donation. If you get 5 to 10 vendors who come in, and you have now $250 to $500 that you've just raised that you have in a budget, nurses typically are paid $25 an hour, and throughout the state, a lot of them are retired school district nurses that we work with. So they're not full-time jobs. They're independent contractors. Our nurses, also have their own liability insurance, professional liability insurance. So they come in and they're sort of their own entity that's working in the site. So that $500 could pay for a nurse to come in, every month, maybe just for a couple hours, to do blood pressure checks and to give people who normally don't want to leave the building or don't want to go through the hassle of making a doctor's office appointment. Primary care copays throughout the state range from $0 to $20, but specialist copays can go up to $50. So, I know a lot of residents that I've talked to over the years who won't go to the doctor because they don't want to spend that $50. But at least if they have a nurse that they can talk to once a month, and, the nurse can help them navigate, what's something that they actually, need to do because this is an acute situation, or if they have a chronic ailment that needs to be addressed that will improve their quality of life, a nurse can have those conversations with them. And it's no cost to the resident, so there's no copay. The supportive services escrow accounts are money that's put aside for supportive services programs for low-income tax credit properties. So PHFA, the Pennsylvania Housing Finance Agency, requires the building to have a certain number of hours per week, as I mentioned at the very beginning. And in order to get their financing and their tax credits to develop the properties, they're required to put money into an account to pay for supportive services for 15 years. So there's a budget that exists, and sometimes the building might have 20 hours that's required or 15 hours that's required. It all depends on the number of units. It's 1 hour for every 5 units. So with a building with 100 units, I've seen properties where they have a full-time service coordinator, even though it might not be required. You'll see further in the presentation why, some property managers might want to consider adopting supportive services programs, even if they don't have a budget, because of the cost savings that come to the residents are so significant. It could help with other tenancy issues, just as simple as helping people to be able to pay their rent, because you're freeing up money that they normally would have spent on goods and services that they just can't go out and figure out on their own when they don't have internet access or, the know-how of a social service professional who can come in and help them navigate the community resources. So that's basically where the funding comes from. And we, as I have said, the senior sites include both a service coordinator and a nurse coordinator. So the pictures that you see here are from Washington County in southwest Pennsylvania. This is a group of residents who built a community garden. So each of those bags were donated from a local farmer's market, and it's the Redevelopment Authority of the County of Washington. They got the plant materials for the residents, and the service coordinator and the nurse coordinator would help the residents, on this particular day where they would have a garden club, and they could take these bags back up to their porches, and it was sort of like a container garden that was portable. So if they didn't want them anymore, or if they got too big, the bags actually had handles so that they could be moved. So that you can see up on the upper right-hand corner in this screen is another community garden that was, around the side of the building. And then the bottom right-hand corner is one of our nurses is sitting in the hall. This was for an immunization clinic that was done. So she was, doing their paperwork, and we provide flu, pneumonia. There is now a new shingles vaccine. So there was a shingles vaccine. There's a new one that's more effective. So that's now being delivered. The annual health fairs, you might think, 20 people might come, so none of the vendors are interested in, coming to my site. So, a home health company wouldn't come because they would only see 20 people or even 10 people. And, we found that just not to be the case. I think as long as you're open with the community-based providers, that, this is a, first-time thing that we're doing, and, there's 40 residents in the building or 60 residents in the building, and we don't know how many are going to come, but, bring food, and we'll have a raffle. I mean, probably about 50% of the residents will come down. And for a home health company to be able to talk to 20 individuals who might need their service is something that they'll do, and they'll pay the $50 to come. The health fairs also give us a chance to find out what people are interested in. So sometimes residents don't fill out those surveys and don't want to do an assessment, but they, just by virtue of the fact of coming down and having a conversation, we encourage vendors to do games and do something fun instead of just, giveaways that people are filling up in their bags and taking up to their apartments, and it's not going to really have any meaningful change. We also, when we're looking at providers to invite to come to the sites, at what provider networks they're in. So if you have a podiatrist who, isn't in network with a major carrier in your market, then it's going to cause all kinds of problems when residents want to go to that podiatrist and they're going to be out of network. So, make sure that's the question that you ask. You want to make sure that whoever you're introducing the residents to can actually provide services to them and bill their insurance companies for it. I bet a lot of you probably have a podiatrist who already comes on site if you're in a senior building. That's a very popular program that I've seen throughout the region as we travel around. Home health companies or places like Manor Care, the skilled nursing, rehab sites, they'll come in and do a bingo, or they'll do stretching, sit and be fit. And these would be ongoing monthly programs and educational sessions that they can do. But then so you can rely on those people that are coming in every month and doing something to come back to the annual health fair to, when you have sit and be fit, when it first starts, you might have 12 residents coming, and then maybe it grows to 20, but then it might shrink down to 8. So the health fair is a way to reinvigorate what you're already doing and to give people an opportunity to meet these providers, and they can talk to them about, hey, why don't you come down and do the sit and be fit this month, and, I can help you further with whatever problem you're having. Insurance reviews. I'm a licensed insurance broker. I got my license back in 2009, and what we found was we tried to work with insurance brokers to go into affordable housing sites, and they just wouldn't go. They weren't interested unless they were going to get a sale. And they weren't interested in this consultative approach where you help residents find a product to help save them money, either in premium or in copays. So now I have over 600 clients. It's all in Pennsylvania, and I work primarily with Medicare Advantage and Medicare Supplement plans. So in affordable housing, what we usually do when we first go into a site is I work with about 10 other brokers that I know in the Western Pennsylvania region and in Harrisburg, who are completely independent. They're contracted with all the carriers, and they can truly go in and meet with someone to see if the insurance product that they have is working and suits their needs. When you have carriers come out and do these programs, carriers want to sell products. So they can't say, this Highmark product's not going to work for you, but maybe you should look at UPMC. That will never happen. Because they can't, because they're only selling one particular company's products. And I can tell you out of 600 clients, I have clients on every single carrier's products, and their needs change. In this particular population, when you have people living in affordable housing, we know that they're low income. So there are a lot of programs that we can help them uncover, and that can include the low-income subsidy under Part D. It could include PACE, which is the prescription drug program in Pennsylvania that helps people over 65. The Medicare Savings Program helps people pay their Part B premium. I'm sure you've run into some people that don't get free Part A under Medicare because they didn't work for 10 years or they weren't married to someone who worked for 10 years. And so, I meet people who were housekeepers and they were paid under the table, so they never got Part A. So they can't, ever go to the hospital. They might have Part B and they're paying for it. And when I have a conversation with them, I find out their income's low enough where they could actually have the state pay their Part A premium. So there's a lot of nuances that insurance brokers can help, in particular ones that have a knack for dealing with people who are low income, and will do this, come in. What you try to do is go in every 3 weeks until, we help people work through the process of applying for even medical assistance. When the Affordable Care Act passed back in 2010, Pennsylvania did not expand our medical assistance program, but 50,000 people joined medical assistance, over those next couple of years, because when they went to apply on healthcare.gov for insurance, they found out that under the old Medicaid rules, they were eligible for medical assistance. So there are a lot of people out there who need help with that, and it's critical to get as many benefits for them as you can, because then they're going to utilize their health care more often. And if they can switch to a plan that has a zero premium plan and then a zero copay for their primary care, you could just get them to use community-based resources that maybe aren't in the building, but the nurse can talk to them about that, and certainly the service coordinator can as well. Another component that we've developed over the years is a panel of community-based health and wellness providers who actually, it's even a formal network that, in Canonsburg, Pennsylvania, for example, we might have 5 different providers who, come into the building on a regular basis, either monthly or quarterly, and they sponsor programs throughout the year. So they understand that the program needs to be funded and the nurse needs to be paid, and, all of the incentives that we use to get residents to come to programs, RE food, is the number one, and bingo. Everyone loves food and bingo. We need to, we need them to help provide that. So we ask, if a podiatrist is coming in, or I think it's on the next slide, pharmacies, home health providers, personal care providers come in. And, we might think of residents as not able to afford, a personal aid if they don't have medical assistance or they're not on a waiver program. So if someone's income is $1,500 a month, maybe they can afford $30 a month for someone to come in for 2 hours and help them clean. So, don't discount what people will pay for if you make it available and you negotiate a rate with one of these, like, personal care home, or not personal care homes, but personal care providers. They're the people that hire aides who get paid under the medical assistance and the waiver programs, but they also do private pay. And if they have a building of 100 residents and they can, provide housekeeping services or, help them do their laundry or help them maybe with cooking, they will improve their quality of life, and, it's only $30 a month. So what we've found is since we've introduced these types of programs, the personal care programs, they increase in utilization because people add on, like, okay, I need 2 more hours a month. The carriers are certainly interested in coming on site. So under Medicare Advantage, those plans are, they have products that are for people who have just straight Medicare or people who have Medicare and medical assistance. Those are called dual eligibles. In southwestern Pennsylvania, we have now Community Health Choices, and those 3 carriers will be the carriers for the whole state. So that's UPMC, AmeriHealth, and PA Health and Wellness. They're all interested in working with affordable housing providers to both expand housing and also to come on site to, to see their members and to meet new members. Individual carriers, so, if you're in a building or a community for families, if someone goes on healthcare.gov to get their insurance, a lot of times those carriers will come out and do enrollments and answer questions for people during open enrollment. So for people under 65 who aren't eligible for medical assistance and aren't on Medicare, they don't have group insurance, they should go on healthcare.gov in the fall. Open enrollment is in November and December. It's a federal program. It's the Affordable Care Act program, and that is critical for people because, especially if they have low income, you're able to get a plan for, it could be subsidized up to almost the entire premium. A lot of people think that they can't afford individual coverage, so they just don't do it. And in family sites, I see this all the time. Unfortunately, in Western Pennsylvania, the brokers are no longer compensated for signing people up for these individual products. And if there are healthcare navigators that you can get to come on site, they're paid through the federal government to help people with enrolling in healthcare.gov. There's a series of questions that you have to go through in order to sign up for health insurance. You need to know what your income is going to be for the next year. So let's say it's the fall and you're helping a resident, enroll in one of these programs. You would go through the healthcare.gov site actually picks up data from the IRS. So you would want your resident to say, okay, well, how much is your income going to be in 2019? I think it's going to be $20,000 because, I have the same job as I'm going to have next year, and I'm probably going to work around the same number of hours. If they say they're going to make $20,000 and they end up making $25,000, then they're going to have to pay premium back on their tax return. And that might be against the tax credit that they get, so maybe they won't have to pay anything back, but they'll have to settle up with the IRS the following year. On the same side, if they estimate they're going to make $20,000 and they only make $15,000, then they'll get more money back on their tax return the following year. So for this particular group of people, I would look for a healthcare navigator in your region. The federal government significantly cut the budget for these healthcare navigators, so I know a lot of it in Western Pennsylvania were getting laid off. If depending on what they do during this open enrollment, there are people out there that, like the Pennsylvania Health Law Project. So, what I tell people is you're going to just have to do it yourself. If you can't find someone to help you, I help people that I come across, and the brokers that we work with, they'll help people just because if I'm going into a building and there are 10 people that can meet with me and 2 of them are on individual coverage, I just bring my laptop and we can go through it right then and there. And the other 8 people might be on Medicare, and I'll get them as a client. So it doesn't, for us, because we're, independent brokers, we can do that. The carriers, if the individual goes directly to a carrier to enroll, then they won't get the tax credits. So if they go directly to UPMC and buy coverage and they don't go through the healthcare.gov and put in their income, then they won't get the tax credits that they need to help them pay for the coverage. That, in addition to the monthly premium, it also could help you subsidize copays, deductibles, and coinsurance. And then there are the CHIP programs. So the CHIP programs are the Children's Health Insurance Programs, and those are administered by various carriers in the state. So if you have a family site, and I find that most parents have their kids signed up for something, but if they don't and they're not eligible for medical assistance, then they should look at CHIP because, again, it's a sliding scale, and depending on your income, they will prorate your premium, and the carriers can do that with you. So this would be a good way to get some good information, and I would just bring all the carriers in. So that's a way to help people, be able to choose for themselves and not be swayed based on the last person they talk to. Certainly the social service agencies, both, the Department of Human Services and the various counties, nonprofit organizations like YMCA and YWCA and, all the organizations that are out there, 412 Food Rescue, that are delivering programs for residents. A lot of times they don't know how to navigate the affordable housing world. So they would love to work with your residents to provide services, but it's daunting and they don't know who to call. And I find when you reach out to them, they're very interested, especially if you have 100 residents in a building or 40 families living in a community, to be able to provide services to all of them, or at least the opportunity to present to all of them and to do their community outreach programming. WIC providers, women, infants, and children, they'll come on site to do education. They have, a lot of these groups have budgets to go out and, they'll bring handouts and recipe cards and all sorts of things. And so these are the types of people that we would also include in all of the health fairs that we have. So the outcomes, this is, and we could probably throw in, 5 more. And on the next slide, you'll see the types of savings that we've been able to generate on a macro level for some of our sites. But it really does help people age in place. and it helps them improve their health status as they're aging, which is kind of an amazing thing. What I really like about this, and in hindsight, now like going to all the housing conferences that I go to and listening to the innovative buildings that people are putting up all over the place that have like a YMCA and a doctor's office and, these cafes and restaurants, that they're co-locating. It's incredible, but some of those things take 5 or 10 years in order to develop. With this program, you could literally implement it immediately just by cut the service coordinator's hours and to replace it with a nurse coordinator. Now, when you're talking to service coordinators, at our company, we've added contracts over the years, so we've only hired people for the hours that we needed to have them work. So we haven't gone in and replaced someone's hours. So that is tricky, and that is not something that we're, advocating doing. I think with the sponsorship model, so if you're interested in even just having a nurse start like 2 hours a month, you can go out and, raise $1,000 to pay for that over the course of the year, or $2,000. By having access to a nurse, it helps them to improve it helps residents to improve their health themselves. So just having the tools necessary to be able to take their medicines on time and to understand why they're taking things and so on and so forth. So the savings that are incurred, these were from buildings that we work in Washington County. They were 3 high-rise buildings that have 103 units in each, and this was over the course of several years. We use Ask Online, which is the American Association of Service Coordinators online software that they developed for service coordinators. We sort of inherited it when we first started working in the buildings because PHFA provided it, and since they've stopped, we've continued that subscription. And there's a line that they actually make you put in when you meet with a resident and you say, okay, we met with this resident and we signed them up we took them off a deluxe insurance plan and put them on a 0 premium plan, so they're saving $280 a month. Or, we got them, signed up for the waiver program so that they now have services that are being provided. Or we got the food banks to come, and this is how much each resident is saving per month. So this is, and as you know, the average income for a lot of these buildings, it depends on where you are, but it could be $1,300 or $1,400 a month. So when they're saving, 7 or 8% of their incomes, and this, goes directly back to them. This isn't like rebates that they have to wait for. This is just savings that they incur by signing up for food stamps or different programs that they're eligible for. So this would be the results of both the service coordinator and the nurse coordinators working together. And that's all I have. So this is my contact information. We're based in Pittsburgh. We work with buildings in Erie, over to Lebanon and Carlisle, and throughout all in between.
Great. Thank you so much, Erin. We're actually going to open up the lines right now to see if anybody has any questions. And if you can use the chat box at the bottom left-hand corner of your screen.
The conference has been unmuted.
And if you don't have a question for Erin, you can mute your phone by pressing *6. Does anybody have a question for Erin? We are getting a bit of background noise, so if you aren't going to ask a question, if you could just mute your phone by pressing *6, that would be great. There is one question from Sophie. I was wondering what percent, if any, of the population you serve was previously homeless prior to placement in permanent supportive housing?
Hi, Sophie. I do not know the answer to that question because, I might be able to find that out. So I can find out in Ask Online if that's something that we ask residents, in particular for the new buildings that we go into that are just being built and we're, the initial supportive services provider. I can look to see if that's something that we've encountered.
Great. Thanks, Erin. And are there any questions for Erin? Any additional questions? All right. If there's no additional questions, I want to thank Erin again for presenting today. We really appreciate it. And we're going to end today's webinar, and have a great weekend, everyone.
Thanks, Colleen.